The bone snapped with a sound like a branch breaking. Pain exploded through the leg, white-hot and all-consuming. The man collapsed in the field, his shin bent at an unnatural angle, white bone visible through torn flesh. His neighbors gathered, staring at the compound fracture that would likely kill him. No ambulance would come, no hospital waited. Just a bone setter in the next village who might know what to do, and a brutal journey to reach him while agony tore through every nerve. How did medieval people survive broken bones when a simple fracture could mean infection, amputation, or death? And what separated those who healed from those who didn't? Before we uncover the brutal methods of medieval bone setting, if you're fascinated by how people survived catastrophic injuries without modern medicine, hit the subscribe button and give a like. Broken bones were terrifyingly common in medieval life. Falls were everywhere. Farmers tumbled from haylofts. Laborers fell from scaffolding while building cathedrals or castles. Children broke arms climbing trees. Women fractured wrists, slipping on icy paths. Combat produced countless fractures. A mace blow shattered forearms raised in defense. A horsefall crushed legs beneath armored weight. Jousting tournaments, celebrated as entertainment, left knights with compound fractures, dislocations and spinal injuries that left them paralyzed or dead. The physical labor that defined medieval existence demanded strong bodies, but accidents were inevitable. A plowshare catching on a rock could throw a farmer forward, breaking ribs or collarbones. A cartwheel rolling over a foot crushed bones to splinters, and unlike cuts or bruises that healed on their own, broken bones required intervention. Without proper treatment, a fractured limb could heal crooked, leaving the victim crippled, or it could kill them through infection, blood loss or shock. The body needed help to survive, and that help came from people with no medical degrees, no understanding of anatomy beyond what they could see and feel, just experience passed down through generations. Here's where medieval medical knowledge becomes clear. The primary treaters of broken bones weren't physicians. Trained physicians, educated in universities, studied Greek and Arabic texts, diagnosed through examining urine and balancing humors, and prescribed medicines. They rarely touched patients directly. Bone setting was manual work, beneath their dignity, so it fell to bone setters, specialized craftsmen who learned through apprenticeship. These bone setters were often barber surgeons, the same men who pulled teeth and let blood, or they were village healers, wise women or men who treated injuries alongside delivering babies and mixing herbal remedies. Their knowledge was empirical. They'd seen broken bones before, they'd felt how bones should align, and they'd learned through trial and error which methods worked. Some were remarkably skilled, able to set complex fractures that healed well. Others were incompetent, causing more damage through rough handling or poor technique. The patient had no way to know which they'd get until the bone setter began work, and by then, it was too late to choose someone else. The process began with assessment. The bone setter examined the injury, feeling along the limb to determine where the break occurred and whether the bone had pierced the skin. Simple fractures, where the bone broke cleanly but didn't breach the skin, were far less dangerous than compound fractures. Compound fractures, with bone fragments visible through torn flesh, almost always led to infection. The bone setter knew this, even if he didn't understand bacteria. He'd seen enough compound fractures turn gangrenous, seen the black rot spreading up the limb, smelled the distinctive stench of necrotic tissue, and watched patients die screaming as their bodies consumed themselves. For simple fractures, treatment followed a basic process. The bone setter had to realign the broken pieces, a procedure called reduction. This required pulling the limb to stretch it, then manipulating the bone ends back into position. The patient was awake for this. No anesthesia existed beyond alcohol, and perhaps some herbal sedatives that barely dulled the edge of pain. The bone setter gripped the limb firmly, sometimes bracing his foot against the patient's body for leverage, then pulled hard. The patient screamed, their body convulsed. Assistants or family members held them down, pinning shoulders and hips to prevent thrashing that could worsen the break. The bone setter felt for the moment when the bone ends met, a grinding sensation and subtle click that told him alignment was achieved. Sometimes it took multiple attempts, each one agonizing, each one risking further damage to muscles and blood vessels. Now the critical technique emerges. Once aligned, the bone had to be immobilized to heal properly. Splints were the universal solution. The bone setter placed straight, rigid materials along the limb. Wooden boards, thick bark, bundled reeds, anything firm enough to prevent movement. These splints were padded with cloth, wool, or moss to prevent the hard edges from rubbing skin raw during the weeks of healing. Then the entire assembly was bound tightly with strips of linen or leather, wrapped around and around until the limb was rigid and immobile. The binding had to be tight enough to hold the bone in place, but not so tight that it cut off blood flow. Too loose, and the bone shifted, healing crookedly or not at all. Too tight and the limb swelled, turned purple, and died from lack of circulation. Bone setters learned this balance through experience, checking the patient's fingers or toes for warmth and color, loosening bindings if necessary. The splinted limb stayed wrapped for weeks, typically 4 to 6 for a simple arm or leg fracture, longer for more complex breaks. During this time, the patient couldn't use the limb. A broken leg meant bed rest or hobbling on crutches. A broken arm meant helplessness, unable to work, eat properly, or care for oneself. For laborers, this was catastrophic. No work meant no wages. Families went hungry while the injured member healed, if they healed. Compound fractures required additional desperate measures. With bone protruding through skin, infection was nearly inevitable. The bone setter first cleaned the wound, washing it with wine, vinegar, or water boiled with herbs. This helped, though no one knew why. Medieval healers observed that cleaning wounds reduced foul odors and seemed to improve outcomes, so they did it. The bone had to be pushed back beneath the skin, a process as brutal as it sounds. The bone setter gripped the exposed bone, often slippery with blood, and manipulated it back into place while pushing the torn flesh closed around it. Then splinting proceeded as with simple fractures, but with the wound packed with cloth soaked in wine, honey, or herbal mixtures believed to prevent corruption. Honey, it turns out, has genuine antimicrobial properties, though medieval healers didn't know this scientifically. They used it because it seemed to work, and sometimes it did. But even with the best treatment, compound fractures killed more often than not. Infection set in within days. The wound oozed pus, the flesh around the break turned red and hot, fever spiked, and the patient faced a choice: amputation or death. Many chose death, either because amputation was seen as mutilation worse than dying, or because they knew amputation itself was so dangerous they'd likely die anyway. Don't overlook this brutal reality. Pain management was primitive and largely ineffective. Alcohol was the most common painkiller. Patients drank themselves into stupors before bone setting, and they continued drinking through the healing process to dull the constant ache. Herbal preparations offered minimal relief. Opium, derived from poppy, was known and used in some regions, especially in areas with trade connections to the Middle East. Mixed into wine or applied as a paste, opium could reduce pain significantly, but it was expensive and rare. Most people never had access to it. Mandrake root, henbane, and other psychoactive plants were used, but their effects were unpredictable. Sometimes they provided relief. Sometimes they caused hallucinations, vomiting, or worse. Often they did nothing. The majority of medieval people with broken bones simply endured the pain. They gritted their teeth, they prayed, they screamed when necessary, and they waited for the agony to subside as the bone began to heal. The psychological toll was immense. People who'd suffered severe fractures sometimes developed what we'd now recognize as PTSD, flinching at sudden movements, avoiding the activities that had injured them, waking from nightmares of the bone-setting ordeal. Class determined the quality of care dramatically. Wealthy nobles could afford the best bone setters. Sometimes traveling physicians who'd studied surgical texts and had more refined techniques. They rested in comfortable beds with servants attending them. They had access to better food, which aided healing, and to imported medicines unavailable to commoners. Their splints were made from finer materials, padded with soft wool or silk. Yet even wealth couldn't buy safety. Nobles died from broken bones just like peasants, though perhaps slightly less often. For the poor, a broken bone was an economic disaster. A laborer who couldn't work for 2 months might lose his home, his family's stability, everything. Some tried to work through healing, removing splints too early because they had no choice, and they paid for it with permanent disability. Arms that healed bent, legs that healed shortened, leaving them limping for life. Fingers that broke and weren't properly set, became twisted claws unable to grip tools. These permanent injuries marked people as damaged, and in a society where physical labor was everything, being unable to work fully meant sliding into poverty and begging. Cripples, people with visibly misshapen or non-functional limbs, crowded cities asking for alms, many of them victims of fractures that healed badly or didn't heal at all. Here's the surprising success that few expected. Despite the crude methods and lack of scientific understanding, many broken bones did heal successfully. The human body is remarkably resilient. Given proper alignment and immobilization, bones naturally regenerate. New bone forms at the fracture site, gradually bridging the gap and solidifying over weeks and months. Medieval bone setters, through observation and experience, had stumbled onto the correct fundamental approach: reduce, immobilize, and wait. Their techniques worked often enough to make bone setting a viable profession. Records from medieval monasteries, which kept detailed accounts of treating injured workers and pilgrims, show survival rates for simple fractures that would surprise many modern people. Arms and legs, properly set, healed more often than not. The patients suffered immensely during the process, but they walked and worked again. Even some compound fractures healed if infection didn't take hold, leaving patients with scars and slightly weakened limbs but alive and functional. The bone setters who achieved these successes earned reputations that spread across regions. People traveled days to see a bone setter known for good outcomes, willing to endure the journey despite broken limbs because they trusted that particular healer's hands. Specific bones presented unique challenges. Skull fractures were often fatal. A blow to the head that cracked the skull could cause bleeding in the brain, swelling, or infection that killed within days. Some bone setters attempted trepanation, drilling or cutting holes in the skull to relieve pressure, and archaeological evidence shows that some patients survived this procedure. The holes healed, bone regenerating around the edges, proving the patient lived months or years afterward. But trepanation was rare and desperate, performed only when death seemed certain anyway. Spinal fractures were catastrophic. A broken back left victims paralyzed, unable to walk or control their bodily functions. Medieval medicine had no treatment for this. The injured either died from complications or lived as complete dependents, cared for by family until infection or bed sores killed them. Rib fractures were common but difficult to treat. Splinting ribs was impossible, so bone setters wrapped the chest tightly with cloth, compressing the ribcage to limit movement. This helped somewhat but made breathing painful and difficult. Many rib fracture patients developed pneumonia because they couldn't breathe deeply enough to clear their lungs, and pneumonia in medieval times was often fatal. The role of religion in bone treatment was significant. Healing was seen as partially spiritual. Patients prayed to saints known for curing injuries, Saint Roch for plague victims, Saint Blaise for throat ailments, and various regional saints for broken bones. Churches held relics, pieces of saints' bones or belongings, that were believed to have miraculous healing powers. Injured people made pilgrimages to touch these relics, convinced that faith could mend their fractures where medicine failed. Some claimed it worked, attributing their healing to divine intervention. Skeptics noted that the journey and rest at the shrine forced immobilization, which is what bones needed anyway, but believers credited God. Monasteries and convents ran hospitals, infirmaries where injured travelers and locals received care. Monks and nuns learned bone setting as part of their charitable work, and some became quite skilled. These religious healers saw their work as serving God through serving the suffering, and their patients often survived at higher rates than those treated by village bone setters, likely because monastic caregivers could afford better supplies and gave patients the luxury of extended rest. Medieval medical texts, translations from Arabic and Greek sources, contained surprisingly accurate information about bone anatomy and treatment. Texts by Hippocrates and Galen described reduction and splinting techniques that mirror modern approaches. Arabic physician Avicenna's Canon of Medicine included detailed instructions for treating fractures, including the importance of cleanliness and proper alignment. But these texts were written in Latin, inaccessible to most bone setters who were illiterate craftsmen. The knowledge existed but didn't reach the people performing the actual treatments. A few educated physicians wrote vernacular manuals in French, German, or English, attempting to spread better techniques, but literacy remained so limited that practical knowledge still passed orally from master to apprentice. The gap between theoretical medical knowledge and practical treatment was enormous, and patients suffered because of it. A physician who'd read Galen could describe proper splinting but wouldn't touch the patient himself. The bone setter who did the work couldn't read the instructions that might have saved more lives. Complications beyond infection killed many fracture patients. Fat embolism, where fat from broken bone marrow enters the bloodstream and blocks vessels in the lungs or brain, was invisible to medieval healers but deadly. Patients who seemed to be healing would suddenly develop difficulty breathing, confusion, and then die, baffling everyone. Blood clots forming in immobilized limbs could break free and travel to the lungs, causing sudden death days or weeks after the injury. Nerve damage from fractures caused permanent loss of sensation or movement, even if the bone healed properly. A broken arm that damaged the radial nerve left the hand useless, fingers hanging limp and unresponsive. Medieval healers had no way to repair nerves, so these injuries meant permanent disability. Malunion, where the bone healed but in the wrong position, was common. The arm might be shorter, bent at an angle, or rotated incorrectly. The bone was solid, so it wouldn't break again easily, but the limb was deformed and weakened. These malunions marked people for life, visible reminders of their injury and the limitations of medieval medicine. By the late medieval period, some improvements appeared. Guilds of barber surgeons began formalizing training, requiring apprentices to learn anatomy and proper techniques before practicing independently. A few cities established hospitals with dedicated staff for treating injuries, creating centers of expertise where knowledge accumulated and spread. Written surgical manuals in vernacular languages became more common, and literacy slowly increased, allowing more healers to access written knowledge. Splinting materials improved as trade brought new textiles and materials to Europe, but these advances were incremental and didn't reach most of the population. The peasant with a broken leg in a remote village still depended on the local bone setter's experience and luck. The fundamental limitations remained. No anesthesia, no antibiotics, no way to see inside the body to verify proper alignment. Broken bones were survived through toughness, through the body's inherent healing ability, and through the skill of craftsmen who learned their trade through touching countless broken limbs. The medieval experience of broken bones reveals the raw fragility of human life before modern medicine. A simple fall could end a career, impoverish a family, or kill through infection. Yet people survived more often than we might expect, their bones knitting back together through processes the healers didn't understand but could facilitate. Every successfully healed fracture was a small victory of experience over ignorance, of the body's resilience over impossible odds. And every person who walked again on a leg, shattered months before, carried the memory of unimaginable pain endured and survived. They lived with crooked arms and permanent limps, visible marks of their brush with death, but they lived. That survival, achieved through crude splints and brutal procedures, reminds us how much we owe to modern orthopedics, and how recently we've escaped the agony that was once normal. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.